Hi, I'm Shelley Bradburn. I'm Sister in Theatre at Goole District Hospital, and I'm going to talk a little bit about clinical supervision. We've done clinical supervision for a couple of years now on a more formal, structured basis. I am a clinical supervisor, and everybody within theatre are happy for me to be their clinical supervisor. I usually organise this as a group clinical supervision discussion, which works well in theatre because then I can arrange it on an audit day through the year. I usually roster people on, which is good because people don't often want to come into things in their own time. About half an hour before the discussion takes place, the list of topics that have been put up for about a week to a fortnight before that are discussed between the group, and they pick 2 to 3 or maybe 4 subjects that they feel they want to discuss in more detail, or issues that they want to discuss. The discussion is structured and we stick to the rules. The rules are passed round beforehand so everybody knows what this entails. It's not a free-for-all. People are given chance to speak, to air their views, and it is a group decision. I facilitate the session just to make sure that it stays on track and everybody gets their say and things don't get too rowdy. Not that they do, they're pretty good. And if there is a topic that we haven't got time to discuss, I like to keep the session to about an hour and a half max, because people do get fed up and I think by then they've had enough. If there is a topic that we haven't got round to, that's taken forward to the next clinical supervision group meeting. If anybody isn't in or annual leave that week, when they come back, I discuss with them what we have discussed as a group. If they wish to have a one-to-one clinical session, then that's absolutely fine. But if they're happy with what was discussed and go with the general census, then that's fine. That is their session then. It works well in theatre, like I say, because it can be organised for an audit day. It is linked as well because of the NMC's revalidation. It is linked because then that can be part of the reflective account and it's counted as participatory hours, so that's all good. Also, through clinical supervision we have changed our practice, and it's linked with ADRs because things can be brought up in ADRs. It's linked to clinical supervision if people want to talk about it, and on the back of that we have done 2 small patient surveys to establish whether or not we are giving a good service. One was to do with ophthalmology and one was to do with the recovery of patients. And it's all good. It's good that we communicate as a team, and outside of our theatre team with the ward and the other wards and departments that we work with. And it's all good. I don't think there's any negatives at all with clinical supervision. It can only enhance and better the service that we give, and I think people like to air their views and know and feel that they are being listened to, and it makes them feel valued as a member of staff and a member of our theatre team.